Welcome back to Valley Life. I am Alicia Safias, and today we're hearing more inspirational stories at the Pacific Medical Center of Hope. Thanks to Dr. Nizami. Thank you for being here.
Thank you for coming.
Now, we have heard a slew of different patients coming in, even just today, telling us their stories about trying to do conventional cancer treatments, maybe not responding very well, or having their cancer come back and then saying, you know, I want to try something different. And that's what you're here for. Kind of give us an overview of what you do.
Yes. In a nutshell, cancer comes back when there is resistance in the cancer. When you use chemotherapy and other traditional methods of treatment, cancer may become more aggressive. DNA goes through the mutations. There are multi-drug resistant genes that become activated. And that's why the cancer has a more tendency to return and recur with more aggressive features. If you don't use the right appropriate treatments along with chemotherapy, the risk of recurrence may even increase. And that's why we see that sometimes patients go through the chemotherapy, they respond very well. After a while, the cancer comes back and the chemotherapy doesn't work anymore.
There are so many things that are happening in cancer research, more things that you're learning every day. A lot of things have to do with genetics, and you really pay attention to that here. Explain that.
Yeah, thank you. So yes, the difference between what we offer and the traditional ways of treating cancer is that we target the genes and epigenetics. And that's my field. In other words, I'm an expertise in epigenetics. I teach in the university-based institutions. I collaborate with National Cancer Institute for the same reason, is because we have come to the conclusion that unless you target the genes with targeted therapies that control the resistance of the cancer and make it more susceptible and sensitive to the chemotherapies, you always have to think about the recurrence of cancer. So the treatments here target the cancer stem cells. We have also done studies that show synergistically they work along with chemotherapies, and they also have independently have significant anti-tumor effect. And so patients come here, they have recurrence, and we tell them that we can start the treatment in a matter of just a few weeks. Their tumor markers respond. In a matter of a few months, their cancer responds in the scan. And the reason that it happens is because it works on the genetic level. It targets the cancer stem cells. As far as I know, there is no other place in the whole United States, and maybe globally, that they have any treatment that targets cancer stem cells.
And that is why you have people coming from all over the country and sometimes around the world to come and see you. Now let's meet this remarkable woman over here, Shannon. And Shannon, you've been telling us about what you've been through with cancer, and just give us a brief kind of synopsis of all of the places you've had cancer.
I started my cancer in the breast area and my adrenal gland. We got through that, and then I went, occurred in my ovaries, 5 tumors in my cerebellum, which is back here in my brain. I did some whole brain radiation. I then had it in my lymph nodes and my adrenal glands. We got rid of that. And then now we're doing my lumbar and a lung. So I figured it's time we did something a little bit more fun in my treatment, and I came over here, and he's just amazing. I started last week. My pain was like 9, and today he asked me what my pain level was, and I said, I don't even have pain. It was just amazing. I totally forgot.
How does that feel to say that you don't have pain, because it's been a 3-year constant struggle for you?
I can't even put it into words, and that's amazing to me. I could talk usually about anything. He's just a miracle worker. I mean, it was just a miracle. It's gone. The pain is gone. So I have no doubt we're going to get rid of the cancer soon.
And this is something that people struggle with. They don't know where to turn. They're doing conventional treatments. What would you say to the people out there, lastly?
Well, I would tell everybody out there that, you know, there is no one way for anybody, for anything rather, that go and find out what works for you. And don't be afraid to look outside the box. There are many new things coming out. And right here is the greatest place ever. It's this little building. You wouldn't know what he's capable of, but it's pretty awesome.
And your treatment has taken you all over the country, and you're back in Fresno where you lived. And does that make you feel great?
You know, it's so much fun coming back to Fresno. I go to Tulsa for my scans. I've been to UCSF. I've been to UC Davis. And it's just something about coming back to Fresno and seeing old doctors, everything. It's been wonderful.
Thank you so much, Shannon, and we wish you so much well with your recovery. It sounds like you're on the right path. Again, Dr. Nizami here at the Pacific Medical Center of Hope. Come in and have a consultation. And Valley Life will be right back.